A new study conducted by Lurie Children's Hospital finds that parents in the Chicago area are very concerned about climate change and how the problem impacts their children right now and will impact their futures. I'm joined now by Dr. Matthew Davis, head of pediatrics for Lurie Children's Hospital. Good morning to you, doctor.
Good to be with you.
Thanks for being with us this morning. So let's talk about this. What did you hear from Chicago parents? What are their concerns?
Well, we heard that about 2/3 of Chicago parents are concerned about climate change, or as many of them see it, the threat of severe weather here in Chicago and around the country. And 3 out of 4 parents here in Chicago are concerned about the effect that severe weather and climate change can have on their children's health. Oftentimes, the way that this translates into health for kids is through poor air quality. It really affects kids with asthma and allergies, and it can make it difficult for many kids to spend time outside and get the exercise that's part of a healthy day for all children.
Was any of this surprising to you, the fact that they're so concerned?
Well, that number I mentioned at the top, about 2/3 of parents are concerned about climate change. That's very similar to numbers we see in national studies of adults in the US when we ask them about climate change. What was surprising to us is that 3 out of 4 parents here in Chicago are worried about the effects of severe weather and climate change on their children's health. That's higher than we anticipated, and I think it indicates the level of concern that parents in our city have related to things like ozone action days and increasing levels of Lake Michigan water as well.
Are we talking a lot about respiratory health when we talk about climate change and our children's health?
We are, yes. Climate change, as you're showing here on the screen right now, can be affected by greenhouse gases, by emissions from automobiles and trucks, and is just much more difficult for children who have asthma and other breathing conditions, like you said, respiratory conditions that are very sensitive to changes in air quality.
With these results, what do we do now? Now that we know that this is a concern, parents are concerned about a lot of things. This is also a top concern for them. What do we do now with these results?
Well, together we can act in small ways and big ways. The small ways we can try to have our own impact in terms of the climate are to walk and ride a bike instead of taking a car, to use public transportation, to try to save energy at home by turning off lights when we don't need them and unplugging electronics that are off. And at the bigger level, we need to work together as a city to try to reduce our energy use. And in fact, the city of Chicago right now is working on a climate action plan that is going to be released later this year.
This can also be an educational portion of this for our kids, right? Talking about that and turning the lights off and turning the water off, and right?
You're absolutely right. In fact, a lot of what we've tried to accomplish at the population level has begun with kids. If we teach our kids about something like, for example, wearing a seatbelt or using a car seat for a child who is verbal and old enough to be verbal and have their toddler car seat, kids will remind us adults about the importance of things like that.
Wonderful.
So if we teach them good habits in terms of the climate and helping prevent severe weather, they can help us out when we need it.
Dr. Matthew Davis with Lurie Children's Hospital. Thanks so much for your time this morning. Appreciate it.